Thanks, Lala. This session's going to be recorded. Um, a learning series, what's that? Why are we calling it a learning series? Because we wanted some quick, short, sharp opportunities to connect, but to also skill you up in a reforming context, making sure you're not missing any information, making sure we're not missing key information from the ground up. Responsive evidence-based learning opportunities. We're going to have some experts that includes some of you in the room. We're going to have outside speakers just to try and build and expand our knowledge of what it would be like building an integrated service system. And I'm going to talk a little bit about that in a second. Build the capacity, capability, and skills and confidence of you all, provide opportunities to get together, and more importantly, and just as importantly, identify and respond to some of those local service system challenges. And we have some. We have definitely got some system challenges, there's no doubt. I want you to think about this situation. Lila is 32. She's got two boys, Sam and Trent. They're both 6. They're 6 and 7. She's just given birth to a little girl called Jamie. Both boys have got learning difficulties. One's been diagnosed with ADHD. The boys have a poor school attendance. Her partner left 3 months ago. She took out an AVO. She's waiting for a community housing allocation. She currently lives in a 2-bedder private rental, which isn't great. The hospital identified her as someone at risk of postnatal depression. She's originally from Queensland. She moved here 2 years ago with her then partner. She's got no family and few friends. That scenario wouldn't be unusual for you as practitioners. But tell me, what services would interact with Lila and her family? Where would she have connection across the service system? Please feel free to talk, unmute yourself. What services have she got? Obviously health, because she's in hospital. She's just had a bubba.
Support
What other
from
services?
support from a family's caseworker.
Thanks, Jane. Thank you very much.
I was thinking that Department of Education, because of the school attendance, as well as potentially a CP, Child Protection Report. So interaction with Child Protection Services, DCJ.
Yep. Anyone else? Well, the reality is, thank you, Jane and Kate, she has already interfaced with a number of service systems. You can see it all here. You know, Centrelink for sure, early childhood services, child protection services, thank you, Kate and Jane. Education, drug and alcohol. There's obviously police when she took out an AVO, possibly an ACO. We're not entirely sure, maybe a cold service. Health, she might have gone to a community centre. Her little boy's just been diagnosed, probably NDIS. CAFS funded services sit in a integrated or lack of integrated service system or service systems. You are funded to provide a service to ensure that Lila and her family get the right services at the right time. If you do not know or understand this complex service system and how it works in our hood, you're going to have a hard time being a practitioner in this service system. And our TEI network meetings last year talked a lot about the challenges of good referral networks, They also talked about knowing what was available, when it was available, who to contact. And that is a critical tool for you as a local CAFS provider. And I'm sure you already know that. And of course, GPs who sit on the side but play a critical role in linking their patients into a service system that often they don't know about. Of course, what we must never forget is that informal care systems should be there to be encouraged, supported, facilitated. So family, friends, neighbours, libraries, other public amenities. I was at Waterloo Library yesterday to do some photocopying, and I could just see the interaction between the librarians and two of the patrons. People go there for support. They go to local businesses, their local cafe, their corner shops, if we've still got corner shops, hairdressers. Those informal care systems play a critical role to keep families, communities, and children safe. I know you know that. And that is why at ISV we take a community development approach to our work, where we actually see a role for everyone.
This meeting is being recorded.
Yeah, in keeping people safe. So what I wanted to quickly talk a little bit about was understanding our local region. When we talk about this local region, we start off by saying, well, governments define their regions differently. I know all of us have been around for a while. So you've got local government boundaries, DCJ boundaries, PHN boundaries, LHD boundaries, police area commands, education boundaries. They don't always align. They don't always align. They're getting better, but they don't always align. But communities have got boundaries that form around natural points, like, just this side of the river, on the other side of the river, or over the mountain, or this side of the bridge, or that side of the bridge. So communities form around those key physical landmarks, but they also form around key social connections, whether it's your local shops. I live in Marrickville, but my Dulwich Hill is my local shopping strip. My local library, my local pool may not be the area or the region or the LGA that I live in. School, my kids went to a school in Dulwich Hill, even though I lived in Marrickville. Closest school, walking distance. So I think understanding how communities work and how those families particularly access their services is critical to our role. At Inner Sydney Voice, we do talk about local government areas, and we do believe that the 1.6 million people in this region, which is 20% of New South Wales population, just in this region, has different communities that they respond to, align with, avoid, connect with. And I think mapping those communities is a really important first step for any CAFS provider. Just so you know, this region has got communities of great wealth and significant disadvantage. We've got a high culled population, 40% of our population's born overseas. 1%, 16,000 people identify as Aboriginal. 14.5% of couples living together identify as LGBTQI. We've got 250,000 children aged 0 to 15, and we've got 365,000 people aged 65 plus. Do any of those facts surprise you?
Rika, can I just ask a question? Is it, when you say region, is that the DCJ South East Sydney region?
Thanks, Elizabeth. What a good question. It's actually the Central East Primary Health Region, so it includes Sutherland Bayside.
Right, okay.
Out to Strathfield. Thank you for raising that.
No
and it's based on the ABS stats. So this sort of blob in the city, you know, that goes down to Sutherland and out to Strathfield and right up to Willara. I am not including Northern Sydney in this. Any of those numbers surprise you?
I'm
Do you-
actually surprised about the 1% is 16,000 people identifying as Aboriginal.
Yeah,
That's a lot. That's a lot of people.
it is a lot of
Yeah, and 1% doesn't sound like much, but when you look at 16,000 people, that's a big cohort.
And it might not also surprise you that a significant number of those people live in the Sutherland Shire and in La Perouse and Redfern. So those communities are formed, they're functioning, and our job is not to intrude, but to facilitate and support. But yeah, significant. I was never surprised, but always, surprised the number of older people, 65 plus, and it's growing. Just so you know, 85 plus age group is set to increase in this primary health region by 131%, 14.5% same-sex couples in our region. Sorry, I can't see that bit. What is it? Oh. Homelessness defines our region as well. We've got almost 13,000 people based on the census last year who had experienced homelessness. We had almost 20 or 19.3 thousand births at the last census. 351,000 non-residents come to the region and work. So every day our region swells by 350,000, and by night time it goes down again to 1.5, 1.6 million. We're growing, and so by 2041 we should be almost 1.850. So it's an interesting population, like all are. It's certainly not homogenous. 40% of the population born overseas, Mandarin being the top language spoken, followed by Greek and Arabic. But you can see the numbers there are really high. So if you're providing services to families and you're unable to provide them in Mandarin in language, you need to really think about that and what that might look like. Anything surprise you in that? What other characteristics do you have to share about this region that you know about your local hood?
Um, I'll go, Marika. So I've spent a long time working in South Australia, and there's a big difference between central Adelaide and central Sydney areas that I work in now. And the difference really is the disparity between the wealthy and the disadvantaged. It's far greater here.
Yep, well said. And what does that look like on the ground?
I mean, certainly in the DV space, we know DV happens, domestic violence happens to anybody. But yeah, there certainly are some differences with the way violence is perpetrated as well. With the more, I guess, the wealthier perpetrators, they sometimes have more means to do a lot of tech facilitated abuse, stalking, and so forth.
Yeah. Thanks, Jane. Thanks. Anyone else? Has anyone else seen any of the demographics play out in your work day to day?
I think the gap in services for young people is becoming greater, certainly in the areas that we work in, and we're seeing an increase in, I suppose, antisocial behaviour and just lack of spaces for young people to be safely and to engage them in, activities and conversations that they want to be engaged in. So there's that, and I'm sure everyone's seen this with the whole e-bike debacle and all the controversy that that's causing.
Yeah, young people always get, identified for some debacle. True. Thanks, Emma. Thanks. We're seeing lots of grandparents involved in the care of their children or their grandchildren, sorry. I'm particularly seeing that in and around Green Square, where there is a very high percentage of Chinese-speaking grandparents who are caring for their grandchildren. So at any one given point, you'll see them in their prams trying to walk the car-ready streets, not the pedestrian-ready streets. So I can see how that demographic is playing out locally.
Marika, also, we run a grandparents support group for grandparents parenting their grandchildren or having a lot of involvement in grandchildren's lives. But we were also a couple of years ago ran a forum, I guess, and what we heard there were the Chinese grandparents were actually being brought over from China.
Correct.
For that sole purpose, and they couldn't go on holidays together, they couldn't go away, they were slaves in their children's house, forced to look after the grandchildren. And that's what we were hearing from some of them. They had no option, which was really an eye-opener for us.
Yeah, thanks, Elizabeth. Wouldn't mind talking to you a little bit more about that, because I think that's certainly the anecdotal evidence down here or out here. So we're trying to build a bit of a picture around that. Anybody else? Anything else that's glaring for you in your work that really stands out? Anyone working with families who are experiencing homelessness? Anyone working with LGBTQI community parents? And is that different in terms of your services? Well, there are things to think about. If you're not targeting cold people and they're not coming to your service, if you're not creating safe spaces for LGBT community parents and families, then maybe that's something we need to think about across the region. But we'll continue to look at some of that evidence and see what it looks like and feels like in your service delivery. Okay. Questions, comments so far. I had asked for those people who did arrive a little bit late, it would be great if you could put your cameras on. This is an interactive session. Thank you to those who have put it on. Would love to see your faces and have you really engage in this very quick 1 hour session. I'm really happy to introduce and hello Cecily Curry, who is our commissioning manager for the CAFS program for our DCJ district. Cecily, warm welcome. I know that you've had a little bit of a break. Does it feel like you've had a break? Oh, I'm sorry to hear that. Welcome to you. Most of you might already know Cecily if you've attended any TEI forums or been anywhere, you would have seen Cecily. So welcome, Cecily. Yeah, your audio is not working. While Cecily gets her audio, I'm going to pick on you, Mike. Mike, are you there, or is it just
Yeah, I'm here.
Sorry, Mike. I'm going to pick on you. You said you're a 9. Tell us what you're so optimistic about, which is fantastic. for your CAFS program?
We have a very strong team here at the Hub that has been with us during this transition, and we've really focused on sharing all that information to every single corner of our team and making sure that they're along that journey with us. And so that started very early last year and continued right up until we had a break over Christmas as well. So I felt like it wasn't just a one person here in the office that was dealing with all that information and absorbing it and making sure we knew where we each were going to be going in the new year. And so yeah, we started January very strong.
Good on you. Good. Sorry, I picked on you. And I know that in your particular area, you've got a really diverse, well, we all do, but you've got a really diverse team and diverse, population group that you're working with. Are you able to access of a lot of that diverse population? Are they coming to your parent groups?
Yeah, absolutely. We have a very big and very diverse cohorts that we work with, and each program that we and service that we offer reflects that. So I think, yeah, we have the supported play groups, and we have casework, and we have a lot of social programs, and you can see those changes as well. Like during the course of last year, our Chinese speaking community really grew, and that was a lot of word of mouth. That we had a couple of clients that came in and loved what they were seeing and what they were experiencing with us. And then over the course of a month or two, it grew from around 5 to 50 to 100, and it's just continuing to grow in the new year now as well. And having the opportunity then with multilingual staff, being able to have really in-depth conversations with them and survey them around what are they wanting, what are the needs that they've got, and responding in real time, not waiting for data in the back end of decks or waiting for census information, being able to use it really quickly and be agile. I think you're on silent.
Thanks, Mike. I think it's a real critical resource for our region to have bicultural, bilingual staff who are trained and supported. Thank you, Mike. Cecily, how'd you go with the... Oh, we've got a no-go with the... Oh, wow. Well, when we can make up stuff, we can do a double take and see. We can make announcements about what DCJ are doing here. Okay, it's all right. Well, I'm sorry you've got no sound. I'm not quite sure what that story is. If it does come back, we'll put your hand out or scream out or something. That's terrific. Midna, did you want to say anything about where DCJ is at and the commissioning process? Because you might have some sound.
Probably I do. Can you hear me?
Yes, yes.
Yeah, it's all good from our end. It was very, very busy before the end of 2025. But now we are on track and waiting for Cecily to have access to her camera and sound system. Can I suggest, Cecily, if you turn off the camera and probably use the microphone, maybe, or jump out and then back into the meeting. But it's all good, and I'm looking forward to having like contract meetings for the new CAFS contract. I had beautiful, wonderful negotiation meetings, and it's good. I'm looking forward to working with providers on the new specs.
Thanks, Midna, and thanks, Cecily. We do appreciate that, our DCJ colleagues were absolutely pumped getting these contracts out. I think we've got, is it 104 contracts across our district? Is that right? I think it was. No.
Can you hear me yet?
No. Yes.
We can hear you now, Cecily, and see you.
Yeah.
You may have an echo because I'm in twice. Sorry. But no, we don't have 104 contracts anymore.
So what happened across the district is everyone who had more than one TEI contract had it amalgamated into one CAFS contract. So that will make life easier for accountability and a whole range of things, we hope. Although the system is a little bit more clunky in some other ways. If you've had a look in packs, you'll see some differences in your contracts. But yeah, I'm sorry about the technical issue. I have you logged into my work, which is where my sound doesn't work. So I've put you onto my private account where the sound works. Complicated.
It's okay. Well, it's great you're a techno junkie to work that out. Can I just suggest that you mute the one that mute one of them that doesn't work, because then we won't get the echo.
I'll try my very best.
And while you're doing that,
yep, sorry, how are we going now? Does that sound better?
much better.
Okay. Marika, you sent me some questions. I'll just run through a little bit about some of the questions Marika sent are interesting. And Elizabeth, you came up with a really good question about what was the region. So even I was confused when we talk regions, Marika. Sorry. So basically, and Marika asked me what were the changes between TEI and CAFS. Well, the TEI program was brilliant, but the CAFS program is even better. That's one of the major changes. We think there has been some shift, and one of the biggest shifts in a program actually is the sector support and coordination service delivery. There's been quite a number of shifts in the wellbeing and community strengthening stream, with a reduction of some of the service activities where they've collapsed. So we don't have multiple social participation anymore. So all in all, I think it's easier for any incoming CPOs to know exactly what we've contracted you for. Any new coming staff to your organisations have a better understanding. The program specifications are much more extensive in CAFS than they were before. I think they support the sector a lot better to understand what the objectives of the program are. Some of the things that I thought about this, what would services like to know in particular? So if we look at material aid, for example, material aid was a service type under the last program area in TEI. It was set on its own. Now you'll find material aid sits in family capacity building, and it can also sit in information advice and referral, which is, I think, one of the best things, because it can then become a soft entry point for people coming into that service. Somebody comes in, they desperately need something, and if you have to turn that person away, especially a neighbourhood centre, because you can't accommodate that request, that becomes that person won't come back. So if you can accommodate them, they'll continue to come back, they'll engage with your service. You will be able to engage with them, refer them on to other services, and support them becoming less vulnerable and not going into a crisis mode. So that was one of the very big positives that I think out of the changes in the CAFS program. Family capacity building has a whole range more things that you can do in family capacity building as well. And we've taken away that difference between intensive and not intensive, but just community targeted support as it used to be. So it's, I think, a lot more easier to understand and a lot more user friendly for the people, the client facing people. With sector development, the biggest change that I think everybody here today would acknowledge would be the lack of funding to interagencies. So DCJs CAFS program no longer support funding to fund an interagency. So something's happening in that space, but don't ask me what, because I don't know yet. But I will keep you updated as soon as I do know anything. Unfortunately, we have been a little bit busy in the program, with the program area in CAFS. We're still finalising the end of contracts. All of you would know that you have end of contract obligations for your TEI program, which need to be met by the 28th of February. And I think it's good that I'm telling you that now, because there was some confusion with us about what that end date was, and that I apologise for any of that. Now, Marika asked me another question, which is where I got into a bit of strife. Sorry, Marika. And that question was, how many CAFS contracts are there in our region? So overall, can I say, in the district, so we now only have 89 CAFS contracts. So that's the former district. For those of you who don't know, we don't actually work in districts. So this is also confusing for us at this stage. So some of you may know that we're going through a restructure in in commissioning and planning. And part of that is around where we will sit and how we'll operate going forwards, us as individuals. Hopefully we get to know that soon and we can talk to you all about it. We don't actually know what that will really look like at this stage. So we sometimes use naughty terminology like the word district, but we're told not to refer to ourselves as districts because the CS teams have also had a bit of a restructure as well. So at this stage, what we say to cover ourselves off is Sydney, Southeast Sydney, Northern Sydney, and leave the D off, so that you still know that what we're talking about. So that in that Sydney, Southeast Sydney, Northern Sydney, we have 89 CAFS contracts going forward. Plus we have 2 safe and strong. So I'm quite happy to talk about the safe and strong contracts. So the safe and strong contracts are
Cecily, I'm just going to interrupt and pause you there.
Yep.
And appreciate that the contracts are different. Can you give us any indication whether any money left that area, that region from TEI when we, shifted over to CAFS? Because we're really interested in whether the region has lost any funding resources.
We have had some funding. There have been some contracts that didn't get renewed for various reasons. And so there was money returned to DCJ. At this stage, however, we haven't even gone anywhere near reallocating that funding. That is a big piece of work that we hope to start on next month. So I don't know what it's going to look like. I'm still tidying up how much money, for example, we as an area did recoup from the TEI moving into CAFS. So I'm not even sure of the total funding at this stage to give an announcement of that. But we are planning to start work on looking at that in February. No, it is February now. So let's go with March. Next month is what I was told. So I just think it's still January, sorry. So the program area will work with us around what that looks like. Money coming back into the sector will have to go through a procurement process. So it will most likely be tendered. So there will be tenders offered. But what it looks like, I can't give any details at this stage. We did get quite a little bit of people we got some who didn't want to operate in the program. for very good reasons, and that's fine. I think it's good that they were committed to giving money back and saying there's other people who can deliver it better. So yeah. So hence we've gone from, what was it, 103 contracts now down to 89. So some of them were money that was given back. But we did have a lot of that money start to come back before we went to recommissioning, to be honest. So we did have a lot of people giving back contracts before we got to the negotiation stage.
It's really interesting. I'm going to, I know we're in a public forum here. I've not heard of anyone giving money back in our region. So
Okay. That's the difference, the region and the district.
Okay. Well, that's because certainly I don't know of any provider. In fact, I only know that my colleagues on the ground are saying, look, if we had a little bit more money, we could do blah. And what we're trying to do is coordinate a map of where a little bit of more money would make the most impact. So I'll be really interested in talking to you about any of the money that was taken out of this district. So I want it to go, how we can make it go back into the district or area or region for the providers in this space.
So some of you will know that some of the councils may not, that didn't impact our district greatly at all. So there were 13 councils. We have one council that will have an 18-month contract. So that didn't impact this district too greatly. And the people who gave their money back were all in Northern Sydney.
Okay. Well, that's good to know, because our relationships, and the information sharing sort of ticks a box. I'm just conscious it's 1:15 and I've interrupted you. Is there any other messages you want to give this group? Because then I'm going to ask whether or not anyone wants to ask Cecily a question or two.
No, but I would there's one thing I just want to say for people to be considerate when working with your sector coordination services. I really thank Marika for today's session, but there's a big change for those service providers. That would be the most dramatic change. And I would just ask services to be gentle with them, because they're going to learn as they go along for the first few months. I think the first 6 months will be kind of a rocky road. We're still working out details of what we particularly want and how we measure what we want and how we want it to all look. So they will rely heavily on your input as well. So please be open and frank with them. Let them know how you're feeling, what you're traveling. So we want to work more closely with our sector coordination services to be able to support sector work. So that would be the biggest change, I would say, and that would be the biggest message I'd like to give.
Oh, thanks, Cecily. Great. Look forward to that then. And I think the strength of certainly this area is those relationships that already exist across the service network. So we would, I'm sure we'll look forward to any of those challenges. I'm looking around the room, and is that, I'm kind of thinking we've got a senior DCJ person online. We've got two.
Marika, can you stop referring to my age?
No, wasn't referring to your age, or mine. Experienced. We can ask Cecily stuff. I know, because I always ask her and she always gives me an answer. And I guess the question to you is what's going to make a difference to you? We've got Mike who's saying, when will a CAFS report be available in DEX for the data? So that's the first question. Thanks, Mike. Are we any closer to that DEX reporting, quality check the data we enter? So apparently there's a reporting mechanism in the DEX.
I have to confess, we haven't quite got our heads around getting up to date with checks yet. As I said, we're still doing some housekeeping behind the scenes. There's been some problems. Most of them have been ironed out. And so some services are now reporting, and the CPOs will start. I know some of the CPOs have started looking at the data. The data reports won't come out just yet, like the large dashboards won't come out just yet, but they will. But as far as we're aware, the major problems have been ironed out. So if you're having any DEX issues, I would suggest that you talk to your CPO, because last I heard, our people said that they'd ironed them all out, and that there should be no issues with DEX at this stage. Some people have problems starting new outlets, but there should be no issue with those. That there has been a change in the helpline. I will admit that you can no longer ring up somebody at DSS and ask them for support. You now have to email through.
I think there was going to be a reporting capability set up in DEX, and I'm not sure whether that's still there, whether that has been set up, but we'll maybe check that out. There's a really good question here from Emma from JNC. Have we got any new ACOs in our hood, in our area, in our region, whatever we're going to call it? Have we
No.
managed? No, we have no new ACOs.
Not in the last 12 months, 18 months. No.
Okay. I know that there are some organisations, well, certainly one organisation that is transitioning to become an ACO, and that's all gone out publicly, and that's Glebe Youth Service. And Natasha, I don't know if Natasha's online today, the new CEO, is working with the community to shape that going forward. But I don't know of any other new ACOs either. There's a really good question here that really picks up off what you've just said around sector coordination, and you don't know what's happening with DCJ about, forums and interagencies, but is DCJ planning on hosting a CAFS forum?
My
And that's a question
understanding,
from Kate.
my understanding is yes, they are, but I don't know any more details than that. All I can say is they're planning on hosting forums, but when, how, and who, I can't give any more information.
Fair enough. And that's a really good reminder to make sure that you do work with your local sector support agencies, which I'm sure you will, to help plan those forums if that's what DCJ wants to do. Jennifer, thank you. Jennifer Curry from Glebe Youth Service, thank you, you're here. She said, Natasha isn't here, but I'm here. Sorry, Jennifer. It's great to see you here. And was I right in saying that is what you are doing as an agency, transitioning to become an ECHO?
Yes, so I believe we have our board and members up to scratch to meet the requirements. So I think we're just working with DCJ and CAPO to finalise that transition and the requirements to become an ACO.
Thank you. Thank you and welcome to today.
Thank you.
Anybody else? Elizabeth, I love what you've just said. You went to the International Federation conference and people were calling it cost of living crisis, but everyone's saying, it's not. It's actually a profiteering crisis. The gap between those who have and have not certainly is widening. And we can see it play out in a whole range of different ways across our hood. People who we call them the new homeless, or the new poor, people who haven't experienced financial disadvantage. What is really interesting is that we have a network of people with lived experience of disadvantage who are now becoming advisors to the new poor around the service system. It's fascinating and it's real community work. So people who know how to get in at Centrelink, people who know how to, access Oz Harvest on which particular afternoon and at which site. So these people are actually experienced, lived experience, and are like a concierge service for people who are new to financial disadvantage. It's actually a thesis waiting to happen, I'm sure, but it's fantastic in many ways, but it's not in the other ways that we're seeing these increase in numbers. We've got 7 minutes to go for this session. What else do any of you want to talk about? You've given up an hour of your time and we're very grateful. It's the first kick-off session of a CAFS learning series. We hope to understand from you what you want to discuss at these sessions every second Wednesday of the month. And we will try and facilitate that between Kate and I and others. Is there anything you want to share today?
Can I just say to Mike that I'll get Nick to call you, Mike? Read the next question.
Thanks, Cecily.
Can I just ask, Cecily, with the service specs, can people hear me? I had someone say they couldn't hear very well last time I was speaking.
You're very low. Your volume is low.
Okay, I'm not sure how to turn that up with my headphones. The service spec states that it is, I'm just reading it here on the screen, young people, outcomes for children, young people, families and communities. Given we are a neighbourhood centre, which encompasses information, advice and referral, can those people be counted in our numbers for information and referral if they are not? I mean, everyone's part of the family, but what else is community? What is DCJ counting as community? So we've covered off children, young people, and families. Is that everyone else?
So in information, advice and intake for you as a neighbourhood centre. So Elizabeth, when someone comes into your centre, no matter who they are, they're a one. Do you count them?
We do count them, and that reporting 50% identified as those people as well. Yeah.
Yep.
Okay. All right. Great. Thank you for clarifying that.
Anyone else? Do not go. I've just put it in the chat. Please take it 2 minutes to give us some feedback. This is the first session of a series. We really want to try and make it worthwhile. We're particularly wanting to target frontline workers and those middle managers. There is the TEI, CAFS, sector development network meeting, which is really going to focus on sector coordination, that we will continue. Just go to the ISB website. I think Lala sent out an invite to people. We'll continue that network planning meeting, real focus on coordination. But this is going to be about quick, short grabs of information and training. 2 minutes to complete that survey. We'll be very, very grateful. And that will help Kate and I and others, the other sector coordination agencies, try and share our resources across the hood to suit your needs. Thank you for giving up an hour. Very nice to see your faces, nice to see your names. I'm going to be calling people out when they don't turn their cameras on. I know some cameras don't work. I appreciate that, but I really appreciate your time. Anybody, just 5 people, 1 word to describe your interaction today, this 1 hour interaction. Give me 1 word. Anyone.
formative.
Thanks, Kate. Jessica, I'm going to pick on you. Jessica Decker. Hello. One word.
Educational.
Thank you. Doesn't have to be positive. Helpful, informative, helpful. Excellent. Anyone else got another word? Can be a rude word. I'm going to say pleasure. Very nice to see you all. Thank you for your time. This will be available online. There wasn't anything that we said that shouldn't be available online to everyone. Very nice to see you. See you around the traps. Reach out if you need anything. Very warm thank you to Cecily and to you, Midna, for turning up today. I know we're going to have you in a meeting very soon. Take care, everyone. Stay cool.
Thank you. Bye-bye.
Thanks, everyone. Thanks, Marika.
Thanks so much, Marika. Lala. Bye.